Hello, my name is Avery Haller, and I have a master's in public health from Bastyr University. I am here today to tell you a little bit about why climate change is a public health issue. If I had to sum up why climate change is a public health issue in one sentence, it would be this: our ability to live healthy lives and prevent disease depends on a stable climate that provides fresh water, nutrient-rich foods, and habitable temperatures. And the reason this is especially relevant right now as we're going through a global pandemic is that as the climate warms, new habitats will be created that will give rise to new microbes, new viruses, new habitats for mosquitoes that carry disease, and we are going to see an increase in novel viruses. Human beings have had to deal with new diseases cropping up throughout human history. However, the worry with climate change is that disease habitats will expand more quickly than we can adapt to. Let me start with a statistic from the World Health Organization. The World Health Organization estimates that between 2030 and 2050, over 250,000 preventable deaths will be caused by climate change. So how can climate change cause death? As the climate warms, there will be more extreme weather events, including much hotter summers, which increases the incidence of heat death and heat stroke. As the climate warms, as I mentioned, there will also be new habitats for animals that carry diseases, such as mosquitoes, which will increase the rate of malaria around the world. Additionally, as habitats change, our food supply is disrupted. With an unstable food supply, there may be an increase in malnutrition, which can cause death. In the video overview of public health, we learned about the social determinants of health. To review, the social determinants of health are everything outside of the doctor's office that keeps us healthy or unhealthy. We also learned about health disparities, also known as health inequality. As the climate changes, health disparities may become more pronounced, health may become more unequal, because climate change is going to affect communities differently. Communities with more infrastructure and more wealth are more likely to be able to adapt to new diseases or changes in the food chain. I hope I have convinced you at this point that climate change is a public health issue. And I just want to reiterate again that our ability to stay healthy and our ability to prevent disease depends on a stable climate. So as you can imagine, public health officials are very invested in the issue of climate change. The Center for Disease and Control, the CDC, has a program called Climate and Health, where they focus on preparing communities all around the country for the impacts of climate change. If you are a young person, I know that this is extremely frustrating. The future of your home feels like it is in the hands of decision makers who are not taking climate change seriously enough. Let's all do our part to support each other and do what we can, and ultimately make sure that those decision makers are accountable for protecting our common home. If you are a person in a leadership position watching this video, I know that it's scary to take a stance, but the time is now. There is enough public opinion in favor of reducing the impacts of climate change that it's worth spending the extra time and money on research and development to create the zero waste economy that we know we need. By advocating for a stable climate, you are not only saving the earth, you are saving human lives. In sum, the time for courageous action on climate change is now. We can ensure that we take care of our home and leave it clean and beautiful for the next generation. We can save human lives as well as all the plants and animals. Thank you, and I'll see you in the next video.